Hello, my name's Rebecca McIntosh and I'm a Project Manager with the Australian Cancer Survivorship Centre based at the Peter MacCallum Cancer Centre in Melbourne. Today's session will provide an introduction to and an overview of cancer survivorship. We will also discuss needs assessment and survivorship care plans, what they are and why they're important in the provision of optimal survivorship care. Finally, we'll share with you some resources available for patients and carers as well as for health professionals. In particular, we'll take you through a virtual tour of My Care Plan, the free online survivorship care plan generator, also developed by the Australian Cancer Survivorship Centre. Who is a cancer survivor? An individual is considered a cancer survivor from the time of diagnosis through the balance of their life. This includes people having treatment, getting better after treatment, or having ongoing treatment. It's important to note that some people who have experienced cancer do not identify or even like the term survivor, as it can mean different things to different people. Therefore, it's important to use a term that they are comfortable with. Some alternatives that may be more suitable are life after cancer, life after treatment, and living beyond cancer. Cancer survivors experience a range of physical, social, and emotional and practical issues and have a range of unmet needs. It's also important to acknowledge that family members, carers, and friends are also part of the survivorship experience when we refer to cancer survivors. The broad definition of cancer survivorship is acknowledged to include the full patient experience from time of diagnosis. It is generally accepted that the starting point for survivorship care is after the completion of adjuvant treatment or definitive primary treatment. Currently, there are over 1 million people in Australia who are either living with or beyond their cancer diagnoses. This number is expected to grow over time as both cancer incidence and cancer survival rates increase, with an estimated 1.9 million people expected to be living with cancer by 2040. In 2022 alone, it was estimated that 162,000 people were diagnosed with cancer. This increase in cancer survivorship is largely influenced by medical treatments and improvements in screening, diagnoses and treatments of cancer, as well as increased life expectancies as we live longer. Hence, there is a growing importance of survivorship care as more and more Australians are predicted to be living with cancer in the years to come. Many people do live well after cancer. However, living with and beyond cancer is different for everyone, and following treatment, survivors may have differing experiences, which will vary depending on a number of factors, such as an individual's cancer diagnosis, stage of cancer, and treatment. These experiences may impact physical health, psychosocial health, practical aspects of life, and overall quality of life. Survivors may have varied reactions to finishing treatment, such as feelings of loss of who they once were or abandoned after treatment. Many survivors may experience persisting side effects from treatment, such as fatigue, pain, and cognitive changes, known as long-term effects, and may present soon after treatment finishes. While late effects may present months to years after treatment, such as infertility and organ dysfunction. Psychological issues include low mood, low self-esteem, or the fear of cancer recurrence or progression. Socially, we also know that cancer can impact on a person's whole life. It can deeply change their carers, family and friends, and relationships. Roles and lifestyles may change. Some people may report feeling like a burden to their loved ones. Furthermore, there are also many costs associated with cancer and its treatment, both directly and indirectly. Some people may have had to stop working during their treatment, resulting in a loss of income, and they may also face challenges in returning to work or study after treatment. For those issues experienced by survivors, there are many that go unmet and often unaddressed. A recent systematic review identified the most common unmet needs reported by Australian cancer survivors. These needs could be divided into 3 domains: psychosocial, physical, and supportive care needs, with the majority of the identified unmet needs falling into the psychosocial domain. The unmet needs are outlined on this slide in order of prevalence at which they were reported, some of which might surprise you. Fear of cancer recurrence or progression is the most common unmet need, followed by feeling uncertain about the future, help to reduce stress, worry about partner, family and friends, information about support services. And let's not forget, unmet needs don't occur in isolation. Survivors may experience a number of unmet needs at any given time, having a cumulative effect on their health and well-being. Next, we'll move on to survivorship care, what this means and how it helps to support survivors in managing these issues and unmet needs we've just discussed. Traditionally, survivorship and follow-up care has often been medically led and hospital-based, with the focus on detecting recurrence and new cancers. Broadly speaking, there's been limited focus on symptom management, health risk behaviours, health promotion and managing comorbidities. There's also been inconsistent care coordination across sectors, and screening for non-medical needs is not routinely offered. These various factors contribute to the current issues relating to the care of survivors. So what should survivorship care look like? In Australia, the survivorship care is guided by the Clinical Oncology Society of Australia, or COSA. In 2016, they released their model of survivorship care, and in 2019, a subsequent paper was published describing COSA's position statement on cancer survivorship care. The position statement describes 5 key recommendations for survivorship care, and I'll briefly run through these now. So firstly, they recommend that healthcare teams should implement a multidisciplinary, systematic approach to ensure coordinated and integrated survivorship care. Care should be integrated across acute, primary and community-based services, with the role and responsibilities of each health professional clearly defined. Secondly, personalised, stratified pathways of care are required, meaning that care should be personalised and tailored to individual needs and issues. The type of follow-up care a patient receives should be determined by a number of factors, including their diagnosis and treatment, level of risk, pre-existing health conditions, age, health literacy, and more. In addition to survivorship care, which incorporates surveillance and managing treatment-related symptoms and late effects, survivorship care should support wellness, healthy lifestyle, and primary and secondary prevention. At transition to follow-up care, healthcare teams should develop a treatment summary and survivorship care plan. And finally, survivors require equitable and timely access to services while minimising unnecessary use of healthcare services and resources. In order to appropriately identify and meet the needs of individuals and enable cancer survivors to be active participants in their health and treatment, there are a number of validated tools that can be used in practice, such as needs assessments. A needs assessment is a tool that can be used to help identify needs or concerns that a patient may have as a result of their cancer and cancer treatment. Areas commonly assessed include physical need, for example, concerns regarding pain, fatigue, sleep; emotional needs, such as fear of cancer returning, anxiety; social needs, for example, concerns regarding impact to relationships, sex and intimacy; and practical needs, such as returning to work or study. Using a needs assessment tool helps identify specific areas of concern for patients and helps prioritise what is discussed during an appointment. It aids appropriate, timely, patient-centred care. It allows for identification and measurement of the level of unmet needs in a patient and aids understanding of the common issues and needs experienced by survivors of particular cancers. Screening is the most successful when it's done often and when referrals are actioned appropriately as a result. A range of patient-reported outcome measures can be used to identify and understand the common issues and needs experienced by survivors of particular cancers. The distress thermometer and problem checklist is the most commonly used tool in survivorship care. This is available for patients and carers to complete at any time via the We Can website. Any needs assessment tool should be accompanied by a patient conversation during which concerns can be elicited and clarified. Screening is only the first step in the process. It's what we do with the information we're given afterwards that's most important. Now we'll be moving on to our next section on survivorship care plans. Many international survivorship care guidelines do recommend providing patients with a survivorship care plan at the completion of treatment. In Australia, the COSA models of survivorship discussed earlier recommends that at transition to follow-up care, healthcare teams should provide a treatment summary and survivorship care plan as key tools to facilitate comprehensive care planning and communication between healthcare providers. Additionally, the optimal care pathways, which are endorsed by Cancer Australia and Cancer Council Australia, include survivorship care plans. And finally, a key activity of the Victorian Cancer Plan is to promote and embed equitable use of survivorship care plans in cancer services and primary and community care services. So what is a survivorship care plan? A survivorship care plan is a formal document that typically includes the following information. Treatment summary. So this includes information about a patient's diagnosis and the treatments they received. A summary of current treatment-related side effects and potential long-term and late effects and symptoms of concern to look out for. A recommended follow-up schedule for medical tests and post-treatment surveillance. Wellbeing and preventative health recommendations relevant to the patient, such as exercise or healthy eating. Information about community-based services and resources for further information and help. A process for rapid re-entry to cancer treatment centre if recurrence is suspected or detected, and contact details for key healthcare providers. Survivorship care plans support patient-centred care and can be used by cancer survivors after treatment in a range of ways, including as a record of their cancer treatment, which can be helpful for further care and movement between different healthcare settings and services. As a reminder of what to expect after treatment and things they can do to look after themselves with links to support services. And as a communication tool to share information between the survivor, the GP and treatment team at the hospital. Survivorship care plans can also be a helpful document for healthcare providers by supporting good communication, planning and coordination of follow-up care between the cancer treatment team across the hospital and primary healthcare setting. GPs can use the information to look after other aspects of health and develop a chronic disease management plan. mycareplan.org.au is a free online survivorship care plan generator developed by the Australian Cancer Survivorship Centre. It is quick and easy to navigate and can be used by health professionals and patients as a communication tool to help coordinate care. The care plans are designed for people who have finished curative cancer treatment. It is completed anonymously and no personal information is collected. A personalised survivorship care plan will be able to be created with and for survivors to give them a better understanding of life after treatment. Plans can be easily downloaded and saved or printed or emailed to the patient and/or health professionals as required. mycareplan.org.au can currently generate survivorship care plans for those cancer types listed on the screen. So now let's watch a demonstration video to see how easily it's done. So now we'll move on to our final section on survivorship care resources for cancer survivors, carers and health professionals. The Australian Cancer Survivorship Centre was established in 2010, funded by the Victorian Government and Peter Mac. Our vision is to optimise the health and wellbeing of cancer survivors and their carers. We work with health professionals, survivors, community organisations and policymakers to improve outcomes for cancer survivors. While we do not provide clinical services, we work with a broad range of providers to enable care. While the majority of our work is directed to Victoria, we also engage with and contribute nationally and internationally. Tegan Nash, Project Manager at the Australian Cancer Survivorship Centre, will now take you on a virtual tour of our Australian Cancer Survivorship Centre website. And here you'll find patient, carer and health professional resources and links to education packages housed on the EverQ platform on cancer survivorship care.
The Australian Cancer Survivorship Centre website, petermac.org/cancer survivorship, hosts a wide variety of fact sheets, resources and information for cancer survivors and carers to support them in the post-treatment phase and for health professionals to support them to deliver optimal cancer survivorship care. This short video will take you on a tour of the ACSC website, highlighting some key areas we think will be useful to your practice. So this is the ACSC homepage, and we'll go through 3 sections today. So firstly, the For Survivors and Carers section, secondly, the For Health Professionals section, and then finally, we'll look at the Common Survivorship Issues Directory. So let's start off with the For Survivors and Carers section. There is a range of information in this section, including resources and fact sheets under this resources heading, information about cancer survivorship events we deliver for survivors and carers, information about self-management and community support organisations, and we've also collated a directory of survivorship information for specific populations, including Aboriginal and Torres Strait Islander people and their carers, and adolescents and young adults. So let's take a closer look at the resources page. This page includes resources developed by the ACSC and other organisations. We have a series of general and follow-up fact sheets developed by the ACSC, links to other useful survivorship care resources developed by other organisations such as Cancer Council. So we've got Cancer Council's Living Well After Cancer booklet, and a link to My Cancer Guide, an online directory to find cancer support services. And we'll continue to update this list as new resources become available. There is also information about survivorship care plans on this page, information about life after cancer in other languages, and a range of video and audio resources. So we'll now go back and look at the health professionals page, which I've opened up in this tab here. So again, there is a range of information in this section, including resources and tools, information about events for health professionals related to survivorship, information about education and professional development opportunities, information about models of care, the Victorian Quality Cancer Survivorship Care Framework and Policy Template, and more. So again, we'll take a closer look at the resources and tools section. On this page, we also have a series of fact sheets providing information on a range of topics and tumour types, and these are specific for health professionals. We also link to resources from other organisations, and again, we'll continue to update this list as more become available. This page also includes information about survivorship care plans, a multilingual cancer glossary, and additional resources and services such as the Victorian Integrated Cancer Services and the primary health networks. There's another section on the health professionals page that I want to show you, which is the education and professional development page. So this page includes information about current survivorship education opportunities, and I want to draw your attention to the online learning section down here. And in particular, look at the cancer survivorship online courses. Under this tab, we link to various cancer survivorship online courses, including a 6-module introductory course, a 15-minute rapid learning, and a cancer survivorship course for primary care practitioners. And if you or your colleagues are looking for survivorship education, please visit this page. The final section I want to show you is the Common Survivorship Issues Directory, which I've opened up in this tab. So this directory currently includes 15 common survivorship issues that people may experience following cancer treatment. And if we look at sex and intimacy as an example, Each issue follows the same format. So each issue will include information for cancer survivors and their carers, and include links to useful resources and services relevant to that issue. There's also a section on resources and guidance documents for health professionals, and again, links to useful tools and information are included here. If a patient is treated at Peter Mac or within the Parkville precinct, there's also links to relevant services. So if you identify that your patients are experiencing any of these common survivorship issues, you can direct them to these pages for more support and information. So thank you for listening. Please visit our website to have a look through these pages in more detail. We hope you find our website to be a valuable tool to access a wide range of survivorship information. The Australian Cancer
Of note are the following other cancer survivorship care resources and services, and links to all these cancer survivorship resources can also be found on the Australian Cancer Survivorship website, as you just saw. So in summary, cancer survivors experience a range of physical, emotional, social and practical issues and unmet needs. In order to address these unmet needs, quality survivorship care should provide a focus on the health and well-being of a person living with and beyond cancer. We've seen through this session where and how to navigate to useful resources that will support you as a health professional in providing quality survivorship care to your patients. Thanks for listening. On this screen are the Australian Cancer Survivorship Centre contact details. Please take a moment to complete the survey using the QR code or link shown on the screen.